Today I am releasing the Health and Disability System Review. First, the good news, it confirms what I think the COVID-19 global pandemic has shown us all. We have a very good health and disability system. The response of our health and disability services to the virus demonstrated many of the strengths of our current system. Our health response has been based on world-class expert advice. It has been flexible. It has been quick to adapt and scale where needed. And it has worked well. We've always known our health workers respond well to a crisis. The ongoing challenge is to ensure this flexibility, responsiveness, and cohesiveness becomes part of business as usual. The review is very clear. We can do better. The review found that our health and disability workforces are under considerable stress, and our system is complex and fragmented. It sets out a path towards a better, more sustainable health system with clear lines of accountability, one that is more responsive to the needs of local communities. This is particularly important when it comes to improving health outcomes for those most in need, including Māori, Pacific people, the disabled, and rural communities. The review has made a series of wide-reaching recommendations, which you have all now had the time to read for yourselves. The report recommends the most significant changes to our health system in a generation. They include recommendations for structural change, stronger leadership, and a determined focus on population health. My focus from the outset as Health Minister has been on equity of access and outcomes for all people. The review's recommendations build on that equity agenda. Local planning must drive decisions. Our health and disability system needs to better understand the real needs of the community and when and where services should be available. Cabinet has accepted the case for reform and the direction of travel outlined in the review. Specifically, changes that will reduce fragmentation, strengthen leadership and accountability, and improve equity of access and outcomes for all New Zealanders. What that means is we are committing to an ongoing program of reform to build a stronger health and disability system. Decisions on individual recommendations will be taken to Cabinet over coming months and into the next term of Parliament. This will take time. You can't make changes to a system as large and complex as our health and disability system overnight. But this is a once-in-a-generation opportunity to tackle the long-term challenges our health and disability system is facing. We can build a stronger, more equitable health system that works for all. That is nothing less than New Zealanders deserve. Before I take questions, please let me touch briefly on the next steps from here. Cabinet has agreed that a small group of ministers should drive these reforms. That will be led by the Prime Minister and will include the Finance Minister, myself as Health Minister, and Associate Health Minister Penny Henare. I will also be appointing a ministerial committee under Section 11 of the Public Health and Disability Act to provide ongoing expert advice on implementation and improving system performance and equity of outcomes. And an implementation team will also be set up to lead the detailed policy and design work. It will be administered by the Department of Prime Minister and Cabinet, as is common with significant change. This is a sector full of hard-working people who want the best for their patients. We want to build the workforce and make sure the system is set up in a way that makes it easy to deliver the standard of care and service our health professionals want to deliver for New Zealanders.